Hi everyone, this is Dr. Erdogan by Smile Hair Clinic. So today I would like to share you with one patient's result with you. We have a patient from 2022. We had his operation at that day. It resulted with something around up to 6,000 grafts. So he had the results, so I would like to share it with you. So let's start from his before operation photos. Patient is in the mid ages. He has some receding in the frontal part. He still has some hairs in the frontal part with miniaturized hairs, but he's not using long hair, so he's using short hair form because probably those thin hairs he cannot comb or he cannot give a style. His priority was the frontal part and the crown part, so he requested from us, and his donor area was something like this. Thick hair, it's very small area actually, but the density was good, so we performed a nice number from him. Okay, once he is in the clinic, we talked with him about his expectations, so we drove his hairline according to the existing hairs he had, front and temporal part. We always want patients to guide them about the line level because they have some different expectations, but we always tell them to higher the line. We take as high as possible because we know that if the patient's scale is more with 5, 6 or 7, if the respin side is very large, at that time we want to smallen the respin side to give more density. Sometimes patients are against that, and we are struggling to convince them about taking the line high, but I think we did the perfect line for him. We agree with the patient about that, so we drove the line according to that. So this is the frontal parts planning. Actually, it's a nearly 55 centimeters square frontal part. He had some, once we shaved, he had some low hairs in the mid scalp as well, not too much. And in the crown, I think he had a large crown area with nothing on that part. So what we did, I will first want to show you the incision photos that we did for him, because we tried to give a little bit more thickness, more density in the frontal part. So we used most of the grafts in the frontal density. Then we did something in the mid-scalp transition, and the remaining grafts was used for the crown area. You can see in the incision photos that we do some micro and macro irregularities to give more naturalness actually, and the deviation and the direction is always from lateral to the central part, which looks more natural actually. I prefer to do it. I will show you the transplanted photos to understand. Sometimes patients do not understand from the incision photos or from the end photos, but I think it's a good thing to share with the patients about what we did as incision, because according to the graft quality or graft caliber, we try to give the density. With this patient, I increased the density, like 55 follicles per centimeter square. And his grafts were very in the right amount, so when you see in the photo, it looks very dense actually. This is the front, this is the sides, and this is the crown area. Okay, let's check his progress photos. Patients are, I think, very curious about how it's going to be with the progress. When the hair is just implanted, 2-3 weeks later, we see usually a hair loss, a shock hair loss problem. So patient loses most of the hairs that is transplanted, and sometimes existing hairs affects from that too. In the first month, I think he still not lost too many hairs. So even he has a better appearance in the first month photo. You can see it from his donor area. Looks little not recovered already, and crown area looks, there is most of the hairs just fall off. It's because of the circulation of the crown area, I think. Okay, let's check his third month. In the third or fourth month, we expect some hairs to be growing. Now I think patient is smiling that he has some more hairs are growing. It is not the desired result for sure, but as you see, little just growing. Okay, let's jump to 6-month photos. Yes, in the 6-month photo, I think even now it is a good result. Of course, it is still detectable or noticeable that he had a hair transplantation because density is not too good. But it start growing. I think the patient is start to seeing photos and become happier right now. Donor area healed much better. Crown area is growing. From the side photos, the donor area looks good for now. Okay, let's check the 12-month photo that the patient sent us. So probably this is the final result. In the crown area, it may go a little bit more to see the result. But for example, he has a good photo from the frontal part that his front is fully restored. Mid scalp is good. In the crown area, in some areas, when we planned with the patient, we also planned it for a 2-step surgery because we knew that it didn't complete it in the one surgery, one session. So the front is very good as desired. I'm also very satisfied with this frontal result. Also, this is another aspect. Let's see very closely from front. It's very good. It's very dense. It's not very noticeable. Looks very nice. We don't have the donor photo from back, but I think from the side we have. It also gives a clues about. Mostly we see with the other clinics patients that is some patches with the over ear part because that's low density and there should be a better extraction quality to see not too much thing from the hairs. So it looks very good. And when you see the hairline, actually it's very good. There are still micro and micro irregularities. The tilt is good. It's upper from frontal temporal part. I think it looks very natural and patient is very satisfied with the result. Patient is overall very satisfied and he told us. Thank you for watching us and have a nice day. Thank you.